Track. I'm joined now by Dr. Diana Bueno from VIP Dental Clinic. Great to see you.
Nice to see you too, Aaron.
This is one of those kind of unspoken things that as the economy turns south, people look to save money, and often it's on things that they really should be doing.
Correct.
Yeah, and why do you think that is? Is it just linked to the economy?
There's a link because when people delay treatment, then things are not going to improve. Things are going to get worse. And as they get worse, the treatment will become more complex and therefore more expensive.
What impact do you think that oral inflammation can have on the rest of the body? Because it's not just tooth pain, it can have a real impact, right?
So I'll give you an example with gum disease.
Yep.
So gum disease is a disease that is chronic and is caused by bacteria, but the main component is inflammation, chronic inflammation. So that inflammation is going to be in your gums and the body is going to respond to it. As the body responds to it, then there's going to be some collateral damage in the tissues. This means that the bone is going to get destroyed, the gums are going to go down, but the main thing that is going to happen is going to open the gate for the bacteria, for some molecules, toxins that our own body produces are going to find a way to get into our arteries, for example.
And gum disease is often treated and seen as kind of a silent disease. People don't think about it, let alone know how to treat it.
Yes, unfortunately, it's silent and it doesn't hurt until it's too late. So when the patients come to us because it's hurting, we are already seeing a lot of destruction. We are seeing that there's infection under the gums, and then the treatment is not predictable. All we can do
What
to
do you mean
help
by
the
that? The
patient.
treatment isn't predictable. What does that mean?
So it's not curable.
Oh,
We
I
cannot
see.
cure
Oh,
it.
wow.
So it's a therapy.
Yep.
So we try to remove the factors that are causing that problem, but your gums are not going to grow back. The bone levels, we might regain a little bit, but it's not going to grow back the bone either. So we always going to have a potential problem for recurrence of that disease if the patient doesn't follow the maintenance program. So, and sometimes depending on the host, they might lose some teeth, which is going to impair other functions in the oral cavity. For example, chewing is going to be harder, or the teeth are going to have to
And
take that
confidence as well.
stress. Yes,
Yeah.
and that is the part that is unspoken.
Yeah.
Because a lot of people are out there with a lot of problems and they are affected psychologically, but they don't want to talk about it. So it becomes a burden for the person that is dealing with gum disease, mainly with advanced gum disease.